Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. Our guest in studio today is Dr. John Popp, graduated from Vanderbilt University back in 1969 and completed medical school at Yale in New Haven, Connecticut in 1973. He is currently the Director of Medical Affairs at Janssen Biotech Incorporated, and he is here today to talk with us about some of the latest advances in IBD, or irritable bowel disease research. How are you doing today, Dr. Popp?
I'm doing great, Neal. How are you?
I'm doing well. I'm glad that you could join us today. Now, you're the Medical Affairs Director at Janssen Biotech Incorporated. Could you tell us a bit about Janssen Biotech?
Sure. Well, Janssen is a company that has been dedicated to many products over the years. We have a very large segment of immunology products, oncology products. But I know our focus today is on inflammatory bowel disease, or IBD, and we've always considered ourselves a leader in the IBD community when it comes to research and also providing information for our physicians and our patients alike.
Most of our listeners are healthcare professionals themselves, but could you explain to me if there is a difference between IBD and IBS?
There sure is, Neal, and I'm glad you asked that. So IBS stands for irritable bowel syndrome, and that's a very, very common condition, and sometimes is confused with IBD, which is inflammatory bowel disease. So with irritable bowel, the lining of the digestive tract is not inflamed to the eye, but in inflammatory bowel disease, it is, where there can be ulcerations and a very sick-appearing lining of the bowel. So a big difference. Now, that doesn't mean that some people couldn't have both, Neal. You know, there are a lot of patients that have IBD, but they can have symptoms of IBS as well. But IBS is probably the most common condition that gastroenterologists see in this country today.
Now, does IBS lead to IBD if untreated, or do you get IBD just outright before developing IBS?
No, IBS does not lead to IBD. IBD tends to develop really out of the blue, or de novo, if you will. And sometimes individuals may have symptoms for years, and quite frankly, Neal, they may be misdiagnosed. They may see a healthcare provider who thinks that they have all the hallmarks of IBS, because there certainly are some overlap in symptoms. Both can produce abdominal discomfort, both can produce diarrhea, and these things can be somewhat confusing. But IBD really stands alone in terms of its etiology and what we know about it thus far.
Now, what causes inflammatory bowel disease?
Well, that's a great question. We don't have the exact answer to that, Neal, but we think that they're the cornerstone of the inflammatory process that occurs in IBD. It relates to the immune system responding inappropriately, if you will. So we think that an individual who is susceptible, and that may be a genetic susceptibility, to developing IBD, gets exposed to something. We don't know exactly what that is, Neal. It might be a bacteria, it could be a virus, it could be any one of several things. And then their immune system reacts not the right way. And so it kind of attacks the bowel lining itself rather than the bug or the organism that might be causing the problem. So it's really an imbalance or a dysfunction, we think, of the immune system. And a lot of therapies are designed to try to interfere with that.
Have you noticed in your experience and in your research one area of the country or the world, as for that matter, that has more cases of IBD than another?
Well, that's an interesting question. And for many years, we did not see IBD to any degree in some of the developing countries. And now we're seeing it more and more. So in Asia, for example, we're seeing much more IBD than we did in the past. Now, whether that's due to change in dietary habits, whether it's due to improved medical care and just a more alert diagnostic capabilities, I don't know. But this is a disease that's really on the rise worldwide.
What are some of the latest technological advances in the detection and treatment of IBD?
Well, IBD has generally been diagnosed. We of course, listen to the patient first and assess the symptoms. And if the symptoms sound consistent or compatible with IBD, we then do a series of tests. The most specific tests that we do that actually allow us to see the lining of the bowel far and away the most common one is a colonoscopy. Your listeners, I'm sure, are familiar with that. It's where a tube is inserted in the rectum and advanced up the bowel, and you can visualize the lining of the bowel and often the lining of the small intestine as well, at least the end of the small intestine. You can take biopsies. And maybe we should have said at the outset, Neal, that IBD primarily consists of two disorders, one being ulcerative colitis, where the large bowel or colon is inflamed, and the other being Crohn's disease, where any part of the digestive tract can be inflamed. So typically with colonoscopy, we can make a diagnosis of ulcerative colitis, and since Crohn's disease often involves the colon as well as the very end of the small bowel, we can usually establish a diagnosis there as well. There are other technologies that are available, and I'm sure your listeners have heard of these, such as magnetic resonance imaging, or MRI, where we can look at the bowel. There's something called capsule endoscopy, where you swallow something the size of a capsule, and it takes pictures as it goes down the digestive tract, and then you can download them to a computer and look at the pictures and see what the lining looks like.
What are the symptoms? What should we be looking for if we've had some discomfort for, say, a couple, 3 days? Or should we look at something that, the discomfort doesn't go away and gets worse and worse over the span of a couple of weeks? What should we look for, and when should we seek help?
Well, I think and one of the hallmarks of especially ulcerative colitis is rectal bleeding. And anytime an individual passes blood, for no apparent reason, and certainly you have to remember that one of the most common causes rectal bleeding would be hemorrhoids, which is generally not serious, although it can be. But I think if you pass blood in the stool, you should always seek medical attention, regardless of how long it's been going on, because that is one of the hallmark symptoms of ulcerative colitis. Abdominal pain, which can frequently occur in both ulcerative colitis and Crohn's disease, and diarrhea. And you ask a good question, Neal. So how long should the symptoms go on before you seek medical attention? If you've had diarrhea for a few days, and you certainly might think you have food poisoning or something like that, I would not rush to the doctor unless you had some other accompanying symptoms like severe abdominal pain or fever, things of that nature. But if something goes on for several weeks, I think you need to see your healthcare professional and try to find out what's going on.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio today speaking with Dr. John Popp, Director of Medical Affairs at Janssen Biotech, talking about inflammatory bowel disease. We've been talking about the symptoms, the causes, and some of the latest advances in IBD research. We've also been talking about when to seek help and the differences between IBS, irritable bowel syndrome, and IBD, inflammatory bowel disease. It's been great talking with you today, Dr. Popp.
Thank you, Neal. Appreciate your time.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.